So excited to have you here. And before we get started, I'd like to ask you to please consider, maybe not right away, but shortly when we start getting into more discussion, turning on your cameras and then also updating your name to include your title and the state that you're from by clicking on this 3 small dots by your image later on so that we can know who we're engaging with. We're going to start today out with a pop quiz. I've got 2 items for you, one about early children in early care and education settings, and then one about early educators. Next slide, please. So first, I'd like to ask you to please fill in the blank in this sentence. Compared to K-12 students, how often are children in preschool suspended or expelled? Your options are hardly ever, about the same rate, or 3 times as often. We'll give you a couple of seconds to respond. See what everybody thinks. Take a guess.
Got about 50% of folks weighing in.
Okay, we'll give you guys a few more seconds.
Anyone else? There's just a few left that haven't responded.
Even if you don't know, just take a wild guess, whatever you think, whatever option first comes to your mind.
Okay.
All right.
All right.
Let's see what everybody thinks.
Let's see. We have 60% of people that selected C, 3 times as often, and then 40% that think about the same rate.
Okay, great. Well, yeah, actually, if you guessed C, you are correct. Surprisingly, children in preschool and childcare settings are expelled at 3 times the rate of K-12 students. So most of you got it right. Some of you were thinking it was about the same rate. It's kind of surprising, isn't it? I was surprised as well, and I know this stuff. The numbers, unfortunately, get even more surprising when we look a little more closely at race, ethnicity, and gender breakdowns. Children of color and boys are disproportionately represented in this group. While only 19% of preschoolers are Black children, they represent 47% of preschool suspensions, and boys account for 75% of preschool expulsions. What we know about this and why we should be concerned is that we know that children who are suspended or expelled in these early years are more likely to be suspended or expelled later on in school. They're more likely to be held back a year in school. They're more likely to drop out of school, and even later on in life to be incarcerated, more likely as well. All right, I've got one more question for you, this time related to the early care and education workforce. Next slide. All right, so your question here is, what is the average hourly wage for early childhood educators? So we'll give you about 10, 15 seconds again to take a guess. And your response options are less than $12 an hour, about $17 an hour, or about $25 an hour. Let's see what everybody thinks.
Looks like we've got just over 80% of you on the line. Anyone else want to take a final guess? All right.
All right,
Well,
let's see.
We've got a smart group of people on the line, Melissa.
We
Everyone
do.
is in agreement.
We do. I thought I was going to stump you. Everyone got that one correct. You can go to the next slide, please, Allison. The answer to this question, as you all correctly guessed, is less than $12 an hour. So you are all correct. Congratulations. You got a great score on your quiz this morning, which is awesome for a Friday. Good way to start out the weekend. So let's consider, in knowing that, that early childhood educators are almost exclusively women, and 40% are women of color. Black educators earn an average of 78 cents less per hour than white early educators, which ends up amounting to just over $1,600 a year for a full-time year-round educator. So that's a big chunk of money that we're talking, a big disparity there. Racial disparities also exist no matter what the early care setting. Of center-based settings, Black educators are less likely than others across other racial and ethnic groups to earn more than $15 an hour. Of home-based settings, 75% of Black educators live in households with incomes that are less than the national median. So just think about those numbers for a second. And now let's take it a step further. because if any of these women themselves are also mothers, the figures can get even more concerning because of their financial responsibilities within their families a lot of times. More than 2/3 of Black women are their family's primary breadwinners. And also, compared to only 17% of their peers, nearly half of Black children are raised by single mothers. So I just want those statistics to kind of sink in a little bit and just think about whether or not that's a surprise to you, or whether or not it's something new or it's something that you already knew and is just serving as a reminder as we move into thinking a little bit more about legislation and things that we can do to help improve these circumstances. So now I'd like to turn your attention to a couple of pieces of recent legislation addressing both early childhood suspensions and expulsions and also educator compensation. First, there have been some policies in Arizona, Colorado, Illinois, and Minnesota that are either enacted, they've been introduced the past few years, or are currently pending in our current session that have either limited or eliminated altogether preschool suspensions and expulsions. And actually, it's suspensions and expulsions in the early years. So that could be anywhere from preschool up to about second grade. They get lumped into that group. So regarding the early care and education workforce, newly introduced legislation in Minnesota and Texas leverage state governance structures. Both bills establish working groups tasked with determining ways to increase compensation for early educators. Both bills, interestingly, also address equity. The Minnesota bill aims to preserve and increase racial and ethnic equity and diversity in the early care and education workforce. And the Texas House Bill 619 requires the working group to develop recommendations for eliminating racial and gender pay disparity in the childcare workforce. Finally, Iowa House Bill 13 takes a different approach by offering qualified educators both tax exemptions and also tuition reimbursement. So these are just a couple of examples of some legislation. You'll also notice that a couple of these pieces of legislation have asterisks next to them. I wanted to take a minute to just note that these bills also include some additional systems and supports to the early care and education workforce. Arizona House Bill 2155 establishes an early childhood mental health consultation and referral pilot program. And both of the governance bills from Minnesota and Texas on the right also note improvements in professional development opportunities for early childhood educators. These are examples of useful considerations for policy supporting early childhood education, because they not only address the concerns that we see with suspensions and expulsions or workforce matters, but I think they're kind of significant to note that because they're also providing additional supports to achieve both of those goals. So what are some other examples of legislation addressing early child suspensions and expulsions, or early educator compensation? Does anybody on the line have any other examples that they'd like to just note? You can go ahead and feel free to unmute yourself at this point, or you could throw something in the chat box if you'd like. Just wondering if there's any other examples anyone can highlight for us. Kind of quiet. That's okay. It's Friday. I understand. We're all ready for the weekend. There are a couple of other pieces of legislation from Colorado and Illinois that also provide early childhood mental health consultation supports that have been introduced recently. So just wanted to throw those out there as well. All right, next slide. So today marks the 4th session in our 5-part series on early childhood development and well-being through a race and equity lens. If you've missed any previous sessions or would like to revisit their content for a refresher, you can access recordings, copies of presentations, and additional resources on our alumni series webpage, which you'll find in the chat in just a second. So let's take a look really quickly before we move on to where we've been so far in the series. So during session 1 back in September, we learned about the historical context for racial inequities and disparities that continue to affect families and young children of color. Dr. Rosemary Allen reminded us that race is a social construct. It's a classification of human beings that's politically defined. And she introduced us to Jamal, who you see here on the right, and shared how racial inequities have shaped his early experiences. You might recall that although Jamal was tested as gifted and talented, he was often disciplined for being too active and has been suspended from 3 preschools, which are a few factors directly related to today's conversation. For session 2 back in November, we related this legacy to discriminatory policies and practices that still persist today and result in health inequities for Black families and children. We focused specifically on maternal health and mortality and related state policies as well. So in session 3, which just happened in January, we examined the impact of discriminatory policies that prevent Black families from achieving housing and economic security and how these intersections impact early childhood development. So today we're going to turn our attention to early childhood education, and more specifically to racially biased disciplinary practices with children, low wages among early childhood workers, and also related policy implications for children and families. Next slide, please. So here are our speakers for today, and we are so excited to have all of them here. And first you'll be hearing from Seemaray James, Interim President and CEO of the National Black Child Development Institute. Seemaray has led advocacy work at the national level to develop and to implement strategies to influence policies and also raise public awareness on issues impacting Black children's education, health, and well-being overall. She also provides training and technical assistance to the Institute's national affiliate network in advocating for policy solutions at the state and local levels. You can read more about Seemaray's expertise at the link in the chat box. Seemaray today is going to discuss foundations of making a more equitable early childhood education system and ways that we personally progress towards achieving racial equity. Finally, Seemaray will discuss policy implications and considerations for advancing equity in early childhood education. Following this discussion, we'll welcome 2 additional panelists, Dr. Walter Gilliam from the Yale Child Studies Center and Edward Ziegler Center in Child Development and Social Policy, and also Constance Gully from Parents as Teachers, who will join Seemaray in a Q&A format to further discuss means of achieving equity in early care and education through policy. You'll have lots of specific opportunities today to reflect and to share your thoughts on the topics that we're going to be discussing throughout our time together. But we also invite you at any point to share any questions or comments or feedback in the chat, or feel free to unmute yourself and just let us know when you do have a question. And now I will turn everyone's attention to Seemaray.
Talking on mute, very classic Zoom behavior. Thank you so much, Melissa. So I'm very excited to speak with you all today. As Melissa said, I'm going to talk about my framework for how I think about how we create more equitable early childhood education systems, and then talk about what the interpersonal journey is like for all of us as we seek to be effective in creating more equity for young children and their families. But I'll get started, of course, with a little bit more about the National Black Child Development Institute. We are 50 years old this year, so we can move on to the slide with the mission. And our mission is to improve and advance the quality of life for Black children and families through education and advocacy. And when I think about the fact that we're 50, I think about Black children and what their experiences were 50 years ago in 1970, right at the heels of the civil rights movement, that Black children had seen members of their communities fight, some die for the right to vote, to push for passage of the Civil Rights Act. And so I think about then 50 years later and the experiences of Black children today, having a vice president who is a woman of color. There's so much to be so proud of for Black children, but at the same time, we're still talking about the issue of suspensions and expulsions, as Melissa has already raised. And at the same time, we are having debates over whether or not it's okay to embrace the idea that Black lives matter. And Black children are witnessing these things as well. We can move on to the next slide. And so our work is important for that reason, continues to be important as we seek to ensure that all children have the supports through programs and policies designed to ensure that they are successful. So when I think about advocating for Black children and families, there are three themes that I like to frame these conversations around. It's equity, diversity, and quality. And I put quality last because I think that we very clearly and easily embrace quality, and that's been a part of our conversation in this field for so long. But I don't think that there's as much ease in talking about why equity and diversity are as important and equally as important as quality. So starting focusing on equity, I put here a couple of quotes from a paper that we've written on the importance of a diverse workforce. But just saying that equity and access must be implemented in a way that does not exacerbate inequity. So we can push for high quality early childhood education, but if we are implementing these quality improvements in ways that means that we have less educators of color, in ways that means that diverse children have less access to quality, then we really, what is quality without children having access to it? And research indicates already that that Black families have a lower supply of high quality childcare programs in their immediate areas. And one thing I want to say about this when we're talking about equity and access to quality, I think about quality dollars and the way that states are spending their quality improvement dollars from CCDBG or the Child Care Development Fund. When we think about this, are we tracking how those dollars are spent, and are they spent in a way that advances equity? So a few years ago in Mississippi, there were findings that, and they held a hearing to hear from providers who were feeling that they got lower ratings when they were assessed for quality, and they needed to reach this floor of quality before they could receive quality improvement. So think about that. If you are a center and you obviously care about providing quality because you are putting yourself out there to be assessed, and that assessment shows that you don't reach that minimum level, well, then what are your next steps? Especially, again, a center in a predominantly Black neighborhood who may not have access to the equity or loans that would be needed to improve their quality. If they're not going to receive those supports, what is the next step? And not just what that does for the educators and those small business owners working hard to serve young children, but what does that do for the young children, where we say, well, if you don't have the resources to reach this benchmark of quality, you can't then get resources from us to advance your quality. So just one way that, and the decisions that we make around access to resources when we are designing programs to improve quality, we have to be equitable in the way that we think and approach those. Moving on to diversity. So for me, diversity in the workforce is an essential component to quality. So take, for instance, our carrying forth Jamal and his narrative into this conversation. Think about, do we have quality if children don't see educators that look like them? Or they have diverse educators, they have educators who have not learned about racial bias. And as Walter Gilliam will share as he's coming on, racial bias affects educators of all races. So just because we have diversity, again, doesn't necessarily mean that that we have put in place the reflection and the professional development that would allow for educators who may be bringing their bias in the classroom, unknowingly bringing their bias to bear in the classroom. We don't have the professional development designed to support them in addressing their bias. And so for Jamal, who is tested gifted, he may not be referred to participate in gifted in a gifted program because of that bias potentially. So Jamal's high energy may be seen as a behavior issue, and we don't want this child with a behavior issue going over into our gifted program. But other children who are gifted, their high energy may be seen as them needing additional stimulation and needing more one-on-one engagement, which they'll receive in a gifted program. So we want to ensure that when we're talking about quality, that we also think about diversity and that we also think about the professional development needed. As I note here, educators of color are more likely to refer children over to gifted and talented programs. So we want to think about, well, what is it that we can learn to ensure that there is more diversity in the ways that children are represented who are advanced, that Black children are represented at lower rates, like Jamal, are represented at lower weights in gifted and talented programs. And then finally, we're all driving, what does this mean about the way that we think about quality? The way, by and large, we measure quality in early childhood education has very much been about the drivers of quality that are very general. They're not, we haven't sat down and thought about, well, what drivers of quality are important for diverse children? Because we know that every child's not the same, every family is not the same. And we want to ensure that families have the supports that they need. All children have the supports that they need to be successful. And so when we think about this, that the center that Jamal is in could be identified as high quality, even though there hasn't been any training to address racial bias. It can be identified as high quality, even though 75% of the children who receive suspensions and expulsions are Black and children of color. What does that say about the way that we measure quality? We don't think about these things currently in the way that we measure quality, but I believe that conversations like these will drive changes. With that, I was wondering if we could just pause here to have a discussion about what are the drivers of quality. Maybe if some of you are parents or we're all parts of families, but what are some of the drivers of quality that are important to you that would say, hey, I know that the children in my community need X, Y, or Z, and you're wondering whether or not that's a part of how we define a quality early childhood setting.
Does anybody have any thoughts?
I think we saw something in the chat. Okay. I don't want to start calling on folks.
I put it in the chat. Oh, sorry. I put it in the chat, but my what I was thinking of was like, for me, quality, I would think about like programs that are focused on brain development, that early child learning that's really focused on sort of that brain development piece.
That we're thinking about children being engaged in play and activities that are designed to promote brain development. And one of the ways that we do that, and just thinking about, again, diversity, quality, and equity, one of the ways that we think about brain development is parallel play, that children need to be able to see positive reflections of themselves, that supports their brain development. So positive identity development, it actually supports brain development, and ensuring that our educators are trained in this way and trained to appeal in a positive way to children that are different from them is really important. Because there's diversity, even when there isn't racial diversity, there's still diversity among children. And so you need to ensure that we're preparing our educators, and that's about family engagement. Learning about a child, learning about what makes them special is about learning what makes their family special and having respect and support for their family. So all of these things tie back to the way that their brains develop. And then I mentioned parallel play. So playing alongside other children and seeing how they learn, how they figure out to put those blocks together and knock them back down and build them up again. That's how my daughter does it. But as they see how other children learn about balance and learn about angles, they're going to learn very well. Their brains are going to develop at a faster rate. And so again, the importance of diverse classrooms, the importance of educators who support the identity development and positive affirmation of every child's identity, which comes from having a positive engagement with their family, is important. And it's really research-based. When we talk to educators who have bachelor's degrees, who have associate degrees, we're hearing from them that from research that they are not getting that they're not getting training on how to engage with families well. And so we usually don't tie that back to, well, that's going to be an issue in a child's brain development, but actually it is, and we need to be thoughtful about that. Any other thoughts in addition to brain development? I love that. Thank you.
You
This
just made me
representative,
think. Oh, go ahead. Please go ahead.
yeah, this Representative Mike Bergen from Iowa, and I just appreciate the perspective that you're bringing. It's a little bit new and different for some of the work that I've done in the past in early childhood. Certainly, we look at a quality setting. We look at the environmental aspects of the learning environment. And you've talked a little bit about the professional development training of the educator. And I think it's the combination of that. But when we look at our measuring quality setters, so giving them a 5-star rating, those types of things, measuring that the quality of the professional training and the teacher brings to the classroom and interaction with the children is one of those harder measurement points. But this is very insightful for me, so thank you.
And I think that I love hearing from you just because NBCDI actually manages the TEACH program for DC. So I know that we have the TEACH program in common. But what we can do is some of this may not be these hard measures based on observation, but also measures based on the time given to educators to engage in reflective practices. Are they given time to reflect? What time is spent to engage with families, to learn about the settings that a child is coming from, again, to support their positive identity development. So there are ways that you can implement measurements that are based on educators' feedback. Because who do we want to hear from more except the people who we put our children's we put our children's lives in their hands. We want to hear from them in the way that we assess quality.
About age and cultural appropriateness as a measure of quality.
Absolutely, absolutely. So thank you so much. With age appropriateness and cultural appropriateness, I want to start with age appropriateness because it's extremely important. We do our educators a disservice if they are mismatching their expectations for children with their age. There has to be the right level of expectation so you know how much you need to intervene in order to prevent some of those childhood behaviors like hitting, and teach them and guide them in the right way socially. And so ensuring that educators have age appropriate lens to look at a child will let them know this child doesn't need to be labeled in any negative way. This is completely appropriate. And then here's how I teach. Because if we believe a child should know more than where they are in their development, then we may punish instead of stepping in to teach. And then again, culturally, when we talk about a child's identity, we think about how do we, again, teach them to be socially very comfortable with other children and socially adept, because how they can be socially with other children supports their learning, supports their brain development, as I mentioned earlier. If a teacher understands that child's identity, they may have a way to help them calm themselves or cope. So a really simple example of this is knowing what song families sing at home that may calm a child if they're having a moment. That is going to be a completely different response that they get from that child because they're connecting it to their home environment instead of, you need to be in the corner right now. You're not playing nicely. What can you do to help a child cope and calm themselves and get ready to play in a positive way, in a way that's about teaching and teaching them proper coping mechanisms when, as we know of 3-year-olds, when that tantrum is coming. And so again, I love that we're thinking about culture. We're thinking about how we can support educators, because it's not about being punitive educators. It's about how we can support educators and the knowledge that they need about age and the knowledge that they need about culture. I love these points. Any additional before we move on?
Representative Bergen again. I just add a perspective, which we've been hitting on, is that when we look at school readiness, that the preschool experience that's going to ready that child for school, certainly the academics, knowing your numbers, knowing your alphabet, and learning to read are what people are attracted to. But having that strong foundation in social emotional health, having that self-regulation, and those are the issues that look at the expulsion component. That's the topic for today, and I think you've hit a number of points of the quality education and how you build on that social emotional development of the child.
Thank you so much. I love that. One of the things I like to talk about when we're talking about the issue of suspensions and expulsions is, how do we respond by teaching instead of punishing? That if any one of us can think about the 5 worst things that we've done in our lives, and most of us will get to 3, and we don't even want to keep counting. We don't even want to keep adding up things that we've done. And I make that point to say, we all have been given second chances. Who are we to not give a second chance to a 3-year-old? And NBCDI, we are not an organization who is not aware that there are 3 and 4-year-olds who are presenting behaviors that are extreme to the point where they need to be separated from other children. This is true. These things happen, and we don't want to ignore educators who really need support. However, we know that suspending and expelling that child hasn't helped them with the type of coping mechanisms that they need. That is the core and the crux of this, that suspensions and expulsions do not teach. Research has shown children are not learning to show up in the classroom in a different way. And again, they're not going to be school ready, as we were just discussing, when they come to kindergarten after they've faced suspension and expulsion in preschool. And so what do we do with all this great knowledge? How do we then start to use it to change behavior, to change hearts and minds? Oh, well, I had one more wonderful point before I transition. And just to give a vision, that we envision every child in early childhood education will have a well-educated and compensated early childhood educator earning a living wage and who has affordable access to college education. We want to ensure that the way that we take care of the workforce really reflects, look at a younger picture of Jamal here, really reflects how well we want this wonderful baby on the screen to be supported as well. So I like to talk about kind of the interpersonal journey that I think is necessary and reflects what's been my journey in building and continuing to build myself as a person who can be effective in influencing systems and institutions to advance racial equity. And I use racial equity, literate, fluent, and effective. And I want to be clear about why I use that type of language. It's because I think it allows us to be more patient with ourselves. When we think about learning how to read, being literate, that it takes time. And when we think about becoming racial equity literate, building our knowledge of the research policies and program design that advance racial equity, we should be patient with ourselves in building that knowledge. We should then be patient with ourselves in becoming fluent, in becoming comfortable with having some uncomfortable conversations about race and learning how to impact the people and influence the people around us. And then once we're comfortable having those conversations, then identifying how you take the knowledge and our comfort and building our personal message to be more effective. So I'm going to dive into each of these a little bit to say more about what I mean. But again, this is about that interpersonal journey that I feel like we all kind of probably rotate back through these as well, that I step back to build my knowledge more and more when new research is coming, or think about how I message more effectively. But when Melissa and I were first talking about this, we talked about the fact that, we're patient with ourselves in learning a new subject matter. When we all at some point learned about early education and what it means to have quality early education systems, and we learned about childcare systems, and we were patient with ourselves, and yet, especially in the environment that we're living in, it's you need to know this or else, and it can feel like pressure to be very knowledgeable about information that is new, information that is changing. And I want to invite us all to think about how to have a framework that's very patient with ourselves about building knowledge, about building a messaging that really aligns with who you are, your expertise, what you bring to the table, and your values. And then again, bringing together that messaging and that knowledge in order to create plans to change systems and institutions. Next slide. And so I want to talk about when I think about racial equity and some of the ways that our opportunities to advance racial equity are broken down. A lot of times I think about research and the fact that research and the data that we have available drives a lot of our policy decisions. And so research we put into a few categories. Research that focuses on the strengths of Black families and how Black families are generally facing hostile environments, but there's resiliency there. Research that is all about pointing out deficiencies from Black families when compared to white Americans, and then research on how social class or position influences Black families. But it's all about comparison and not necessarily about strengths or resilience. That negative-based research that focuses on deficiency can sometimes drive us to focus on what we need to fix in families and not what we need to fix in systems. Next slide. And so I talked about that deficit perspective, but as an example, there's consistent talk about the achievement gap, and that achievement gap can be attributed back to lack of motivation, a cultural lack of support for educational achievement. And we know that there are families of every hue, every culture, who care about their children and want them to succeed. And the more that we can embrace those families and ensure that we are lifting them up, the more that we can embrace our children and lift them up, the better our society overall is. And so how do we see this in contemporary research? We had a group of research on the 30 million word gap. This is research I myself have quoted before I started to think really deeply and start to listen to colleagues who were talking about, well, is this sound research? And does this really reflect the differences that some families are facing? And so when we just dig just a little deeper underneath the surface of this research, we find that it very much is a deficit perspective, that young children living in poverty heard 600 plus fewer words every day compared to their middle class peers. This study has been cited far and wide, but there are flaws in it, and the findings have not been replicated in other places. And I want to attribute these notes to Dr. Aisha Ray from the Build Initiative. But continuing to the next slide. So what are some of the recommendations? So practical advice. I actually am getting, I am getting to practical advice, but wanted to lay down some ways that we should think about research a little differently. And one practical advice I can give is to seek out strengths-based, positive, I guess, research that looks for resilience, research on the positive attributes of families so that we can have a balance. Because a lot of what we quote, a lot of that research is, again, about deficits. So we can move on to the next slide. So some recommendations. Think about language. So one of the ways that I talk about this, because I think the census gives us a really great example, we use language like hard to count instead of historically undercounted. That an effective strategy to count children will be designed to count all children. And if it's not designed to count all children, then it's ineffective. That doesn't mean that there's something ineffective about the children and their ability to be counted. So for the past 3 census tracts, we have been less effective at counting children of color ages 0 to 5. That is taking, for per child not counted, thousands of dollars away from communities because of that census undercount. And what we've done is we've just labeled some people hard to count and given ourselves an excuse not to ensure that those communities have the funding that they need from the federal government. We want to ensure that we have census strategies, if they're effective, they're designed to reach all children. And I say this just having worked in at the Illinois Department of Human Services, and when we're implementing a new program where we have to communicate to educators, we have to communicate to families about that program, being unwilling to say, well, we didn't really reach these particular communities because it's hard to reach those communities, and making that okay. What we have to say is we don't have the funding to provide effective outreach. Effective outreach is designed to reach everyone who needs that information. Moving to the next slide. So also, again, taking a strengths-based perspective that really thinks about not just the individual person, but again, the broader societal structures that need to change in order to set our children and our families up for success. Next slide. So as I said, the strengths-based perspective, how are families succeeding in spite of challenges? Just boiling a whole lot of complicated words down. Are we asking ourselves how families are succeeding in spite of challenges? And so again, thinking about what it means. So in the starting with what it means to be racial equity literate, it's about building on and identifying opportunities through research to take a strengths-based approach, to think about what strengths and resilience families bring to the table, instead of always relying on that data that is all about the deficits of certain families. In order to be fluent, I talk about the fact that relationship building takes time. That the first time that we learned about the importance of early childhood education probably wasn't like, okay, I'm sold, now I can go off and spread the word. We needed time to build relationships with other advocates, to build ourselves up, to learn more about these issues. So just think about, as you are talking to others and having conversations about the importance of racial equity, the first conversation isn't going to be a magic bullet. I tell people to use scripts when you, again, think about what your personal story is and how it ties into the importance of equity, that we are all diverse in some way. Even if we look homogenous, we all are diverse in some way. And what has being a diverse person in whatever way you're different, in what ways has equity been important to you? In what ways has being treated equally be important to you? And then I say, hold yourself accountable to share your knowledge. Don't feel guilty about times when you wish you had spoken up in the past and didn't. Hold yourself accountable to speaking up, moving forward. And Martin Luther King has a wonderful quote that I think helps us here. That we will have to repent in this generation, not merely for vitriolic words and actions of bad people, but for the appalling silence of good people. So I know I just told us not to feel guilty, but I think that this is a wonderful quote, just encouraging us to speak up how we can and when we can. And then what it means to be effective. And these are just a couple of examples on what it means to start to be, or for us all to continue to be people that influence systems and change institutions. And the example I used before about hard to count and hard to reach, that we can start to let go of that type of language that basically blames people out in communities for failures of our systems, and start to talk about effective communication strategies designed to reach everyone. That's where we want to move to. We can think about our hiring practices. One of the most wonderful examples from me providing this presentation previously was talking to other policy analysts who were saying, oh man, I really need to have this knowledge in order to advocate for policies in a way that don't exacerbate racism, that don't exacerbate institutional racism, that's something that they wanted to commit to. And I thought, well, think about your hiring practices. Also, think about when you're onboarding people, the types of knowledge that you, thank you, someone told me my camera shut off. I went to look at the chat that just came in from Portia Kennel, and I realized when I'm looking at the chat, it turns my camera off. So Melissa, if you can read off to me what was in the chat from Portia, that would be great.
I think I'll have Jenny do that for us.
Okay,
I can't see the chat either.
Sure. Portia says, language of how we describe people and communities and context matters. We need to work harder to act and see from a resilience perspective. What has been accomplished despite of systemic barriers and inequities?
Absolutely, absolutely. And I think that says it all. And Portia obviously has that language built into her about how we talk about this. But one thing I want to encourage us to do is have our own language. How do you talk about it? How do you approach it? What I was just saying about hiring practices, in the way that people are oriented, when you provide orientation, when you think about how you engage with your staff and how they engage with each other. Could you set up a monthly brown bag to talk about issues of race in a way that is not a pressure situation, but in a way that just allows people to bring their thoughts to the table, to bring what they're learning to the table, because there's so much rich information out there. But if we're not talking about it, we're impeding progress. And so with that concludes my time with you. Well, actually, I'm staying for Q&A, but that concludes my presentation. I just want to thank you all for giving me the time. And I'll stop here in case there are additional questions or comments.
I just want to go back to something you said earlier, that first round of discussion. And I had a flashback to, I'm my knowledge of all of this is dated, but remembering things like the Eckers and the Itters and all of those evaluations to look at early childhood quality. And I think I remember being on there like numbers of books and numbers of materials and different things, but I don't know. I guess my question is, do you know if any of that has been updated to say, to look more at that material content? Is it more culturally relevant? Is it more diverse? Do you know if any of that's been in place?
So I know that these evaluation environmental skills have been improved to think about more diverse books. Where I think we're headed, which is really exciting, is to think about how we think about the interaction that children, yes, are interacting with books, but the interaction between the educator and the child really is the most important part of their day. Again, these are the people who were putting our children in their hands. We want to ensure that they are supported. And so there are tools that are looking at how we assess interaction that is positive, again, that affirms children's diverse identities within classrooms. I don't want to misspeak, but I'll put it in the chat at some point. But I believe the tool is called Access, but I'll put a link in the chat, the tool that I'm aware of that's being developed.
Thank you.
Marie, can I ask you a question?
Oh, absolutely. Thank you.
I really liked what you were saying about, sort of shifting our language when we're talking about families and children of color to, I think I wrote down the question you said about how are families succeeding in spite of challenges and thinking about systems versus, individual deficiencies. I wonder what advice you would have for legislators or legislative staff on the line who maybe want to make this intentional change in their language, but knowing that their work is in part to pass policies to fix some of these, systemic issues. So or address them. And so if they're focusing sort of on how families are doing, how does that affect, when there are still changes that need to be made? Does that make sense?
Yeah, no, I absolutely know what you mean. So a really easy example I can give is who's called in to give testimony. That do you call in families who, with a balanced perspective, who can say, here are the challenges that we face. Here's why this legislation is important, but also we've been able to succeed in these ways. We still want to see those changes, but that it's not always the story of the family that's broken down, but a family who can come in and speak from a position of advocacy, a family who can come in and speak from a position of power and strength about those topics. I think that sometimes we focus on ensuring that we find the person with the saddest story we can possibly find, but we also want to ensure that we find people who have those experiences, but can speak to how systems need to change based on those experiences, and bring them in not just for the sad story, but for their expertise as well.
Well, there's no other questions in the chat right now, Melissa, but.
Okay, well, thank you so much, Marie. I think that will conclude putting you on the spot. Thank you so much for that. That was so interesting. And I am so excited to also introduce our panel. So we're going to move now to our panel. And first, we're going to have Constance Gully, from President and CEO from Parents as Teachers. And then we're going to have Dr. Walter Gilliam join us as well. He is the Elizabeth Mayers and House Jameson Professor of Child Psychiatry and Psychology at the Yale Child Study Center, and also the director of Yale's Edward Ziegler Center on Child Development and Social Policy. So I will go ahead and hand things over to you, Constance, and let you say a few words.
I got the mute flag that time. So am I presenting now, or are we having the questions? Okay. So I'm going to just share a presentation that I may zoom through because Seema Ray was amazing. And I really want to just talk a little bit about home visiting as a strategy and what's happening on the home visiting front when it comes to equity as an industry, and also what we've been doing in the midst of the pandemic. So I'm going to, I think, prepare to share my screen. Let's see. And I think you see a slide now.
We're good. You're good.
You're good? Wonderful. So just a bit about parents as teachers. It plays a leading role engaging the most under-resourced families. So our vision is that all children will develop, learn, and grow to realize their full potential. Parents as teachers is an evidence-based home visiting model and one of the predominant models serving families through the maternal, infant, and early childhood home visiting program, finally referred to as MACV, including through the tribal MACV program. You're gonna hear me mention MACV a lot, but MACV only funds about 25 to 35% of home visiting across the country, but the awards are awarded to state grantees, and states most often leverage state dollars also to fund home visiting beyond the MACV selected models. But PAT offers culturally competent interventions with a strengths-based approach that focus on families during pregnancy and the early years of a child's life. We provide parents and other adults in the household tools to help whole families thrive with an emphasis on maternal and infant health and development. Our home visiting model operates in 48 states and more than 110 tribal communities. The curriculum that we provide is often adopted by other evidence-based models. So the footprint of those that subscribe to the Parents as Teachers curriculum crosses all 50 states. More than half of our programs are actually in rural areas, and home visitors typically reflect the community that they serve. It's my understanding, I know you all heard a lot about what the experts say about early brain development in previous session. I'm just going to do a quick recap and just say that babies' brains are built over time from the bottom up. The brains are highly elastic in early life and less so later on. The more we do early, the more impact it has on the entire life. Cognitive, emotional, and social capacities affect life's course. And that means that it's not just about the numbers and the letters, as was said earlier, but also emotional learning and attachment that can impact mental and physical health. Toxic stress such as violent neighborhoods, abuse, poverty, maternal depression can damage the developing brain and impacts learning, physical, mental health. And you've probably heard of the Nobel laureate economist James Heckman and his research. His argument says that no matter what data you look at, what you find is that programs that start at the earliest years have the greatest return, and that if you are a policymaker, that's where you can focus to get the most efficient use of taxpayer dollars. Investing in early childhood education translates into a stronger economy by producing more educated and skilled workforce, and by reducing costs needed for remedial education, health rehabilitation, and the criminal justice system. So home visiting, although policymakers at different points on the ideological spectrum disagree on the proper size and scope of government services, all agree that services provided by government should work well. An evidence-based policymaking framework may ultimately promote bipartisan collaboration in important policy areas. Evidence-based policymaking has two goals. to use what we already know from program evaluation to make policy decisions and to build more knowledge to better inform future decisions. This approach prioritizes rigorous research findings, data analytics, and evaluation of new innovations above anecdotes, ideology, marketing, inertia around the status quo. Home visiting, what is it? It's a model of serving families aimed at supporting young children and their families, the whole household well-being. Home visiting offers mentorship from a trained professional, whether it's an early childhood educator, a social worker, or a nurse, starting as early as pregnancy and extending into the first years of a child's life, using the premise that parents are a child's first and most influential teachers. Depending on the program, participation can begin as early as pregnancy or during the child's first 5 years. For parents as teachers, we enrolled families from any point in that continuum, from prenatal through 5 years of age. Home visiting provides tools for parents to manage stress and connect to resources within a given community. Ultimately, these programs help parents envision and work toward a positive future and put families on the path to self-sufficiency, or support the path that they're already on to self-sufficiency. I could really spend a lot of time reviewing the research on home visiting effectiveness, but I'm just going to share a handful of studies published over the last 3 years, more recently on parents as teachers. Findings from an evaluation of the impact of PAT in the Sunnyside Unified School District in Pima County, Arizona, found that children who participated are performing significantly better in terms of reading and math achievement, and had significantly lower rates of absenteeism, in-school suspensions, and out-of-school suspensions compared to their peers who did not participate in PAT. In another study, families and parents as teachers scored significantly higher on cognition and language development. And one of the largest US studies conducted to investigate the impact of home visiting on child maltreatment, including nearly 8,000 families, researchers found a 22% decreased likelihood of substantiated cases of child maltreatment when families participated in parents as teachers. A recent groundbreaking study shows the implementation of PAT home visiting interrupts the harmful effects of early life stress on the brains of young children. In another study, researchers found that when paired with the lifestyle intervention, parents as teachers helps Black women gain less weight in postpartum period. Not sure about post-COVID period. The findings from this new study will have significant potential to help reverse the trend of excessive weight gain among young adult women. And that's a critical priority target in battling the epidemics of obesity and chronic disease and Black maternal mortality and health.
Hey, was that everything you have for us, Constance? Oh, I'm sorry.
I have a little more, sorry. I'm a little more than halfway through. This just talks about the policy implications for state legislators when it comes to effective programs like home visiting. I just want to say it's important to note, working with parents directly during the most important stages of their child's early development, it has direct effect on reducing the educational disparities that can later result in income and health disparities. By supporting the overall well-being of parents and caregivers and offering support and resourcing home visitors, it can help parents navigate complicated systems like healthcare, education, and social support systems. But on the federal front, about 2 weeks ago, the National Home Visiting Summit staff from the Health Resource Services Administration talked about their movement toward more systemic ways to improve equity. For instance, the McVie legislation has always specified the requirement to target communities with the highest need, and the risk factors associated with need are clearly defined in that legislation. But in addition, the legislation supports continued innovation by allowing for up to 25% of those funds to support promising approaches and rigorous evaluation of those approaches. That allows models and even more smaller community-based programs to compete for funding so they can become evidence-based. HRSA recently formed a health equity work group to develop and identify opportunities to advance health equity. And there's a McVie Health Equity Collaborative, which is designed to support state awardees to advance health equity. HRSA has also recently put out a grant opportunity for states to look at advancing health equity in response to COVID, to understand how the programs advance health quality by addressing the social determinants of health for families and communities disproportionately impacted by COVID. They'll be investigating how they can align organizational policies and practices with principles of racial equity, shared power with families, and equitable access to quality programs. And on the state front, state funders of home visiting are also doubling down on equity. Michigan Home Visiting Initiatives has a maternal infant health equity action committee that convenes content experts aimed at impacting systemic change by informing policy and putting proven practices into action. So their goal is to advance health equity within McVie to improve maternal child health outcomes. And what many states are doing is using McVie from a quality perspective as somewhat of a benchmark to inform other state-funded models. And both Michigan and California either wrote into legislation or developed new program regulations that require equity in their contract compliance training and staffing, including requiring staff to take implicit bias training, as well as including a health equity objective in their work plans, and requiring parent involvement on the quality teams and so forth. So for the broader home visiting front, parents as teachers really implemented or piloted virtual home visiting. About 5 years ago, we had a 4-year-long pilot efficacy study with the University of Southern California School of Social Work on virtual home visiting. During that pilot, we conducted about 1,700 visits. All 4 components of the parents as teachers model was implemented at that time as a part of the pilot. We conducted about 1,700 interactive video conferencing visits. What we learned from that period informed the forced pivot that we had to make during the pandemic, and we were asked to lead and support the Rapid Response Virtual Home Visiting Collaborative. That was formed to provide best practice principles and strategies to support all home visiting professionals in maintaining meaningful connections with families during this time of increased anxiety and need. So for home visiting, we never closed, we never shut down, we could not because families needed support. So we really had what turned out to be a prescient opportunity with the pilot to inform guidance to support all of home visiting. So this particular collaborative is a cross model. 16 models are engaged in the effort, as well as the Institute for the Advancement of Family Support Professionals. We've launched more than 30 webinars since the beginning of April, engaging as many as about 14,000 professionals across the network of home visiting. And they are informing through the chats and the questions and answers, the strategies and best practices that we've had to deploy over the last year to stay connected with families. All the resources from this effort are free to the field, no matter what program they operate in. One of the goals of Rapid Response is to work to create durable content that will live beyond the pandemic. So there will be 6 modules that home visitors can access. And if they complete the entire 6 module series, they can have a badge that says I am, I have a certain level of capacity and acumen in delivering virtual home visiting. So we're learning as we go through this process. But when we think about the on-the-job training that home visiting has had to engage in the midst of this pandemic, just for parents as teachers, when we look at 2/3 of our affiliates across the country, we've conducted more than 500,000 virtual visits since March of 2020. So what we can learn, we're learning on the job, but what this means for families is beyond the pandemic, we will have more options for families to choose and also meet the needs of families where they are. What we're finding is virtual home visiting is a must right now, but it is not something that will go away. So it's really important to continue to consider the efficacy and the impact of home visiting as a strategy for families when we consider equity and the workforce. One of the biggest challenges and the things that has come up over and over through the rapid response webinar is the need for home visiting professionals and early childhood professionals themselves to have access and to have the time to decompress and to take care of themselves. Like Seema Ray shared earlier, early childhood professionals are underpaid and overworked, and oftentimes experience many of the same stressors that the families that they're supporting are serving. So for rapid response, we think it's an opportunity to even add some equity opportunities to the home visiting and a broader early childhood workforce with free access that professionals themselves can actually inform the content. So it's a churn of an opportunity to strengthen the broader early childhood home visiting field.
Thank you so much, Constance, for all of that context. We have one quick question that came for you in the chat, and that is, has virtual home visiting been just as effective as in-person home visiting?
Well, I think that we will find out in the by and by. I think for parents as teachers, when we did the pilot study, we did learn that for some families, it is just as effective. For others, it's more effective because they're engaging more into the virtual visits. It just depends on what works best for a family. Also, it depends what some of the evaluation of the webinars and the rapid response work. What we're learning is that when home visitors they feel equipped when it comes to virtual home visiting, the impacts are better. The way they engage with families are better. There were questions early on, how can you assess things like parent-child interaction? But what we're finding is you can assess parent-child interaction, because when it's virtual, all you can do is observe it. Home visitors don't have the opportunity to get in the way and say, oh, how cute, and they get in the midst of what really is the relationship between the parent and the child that we're trying to strengthen.
Great. That's actually, Senator Wilson, thank you for that question. That's a great segue into one of my first questions for the panel in a minute. I asked something similar to that. So that's a great way to kind of keep that in mind and get that started. Right now, though, thank you so much again, Constance, for that context and that background that we can take into the discussion. And quickly, I'd like to pass things over to Dr. Gilliam and have him say a few words as well, and then we'll start the panel discussion.
Thank you so much, Melissa. I put together a quick PowerPoint. So let's see if I can do a share screen. Everybody can see this?
Yep, we're good.
Great. Let me go up here. So I'm going to say a few words about some of the work that we were doing on implicit bias. But in order to be able to describe what implicit biases are, which are these unconscious images that we might have in our mind about expectations that we have for others, or the way in which we might expect somebody to behave, or the images that we have in our mind when we think about, what does a child with a challenging behavior look like? What does a child who's creative and smart and bright and the teacher's pet look like? All of these things that are in our minds are things that can impact the way in which we view other children, and as a result, the way in which we interact with them. In a way, implicit biases are kind of like the wind. You can't see the bias, but you can see its effect. And you can see the behavioral effect that it has on people when we have these. And I'll give you a spoiler alert, we all have implicit biases. So here's a riddle that I sometimes use to describe what implicit bias is. Imagine that there's a car driving down the road, and there's a father and a son in it. And unfortunately, the car is in a terrible accident. And you may have heard this riddle before. And in the terrible accident, the father dies immediately, and the son is in critical condition and is sent to the hospital. And at the hospital, the nurses are scrubbing in and getting ready to do the surgery. And then they call in the top surgeon for the hospital, because this is very life-threatening injuries here. And so the top surgeon in the hospital comes there, and this top surgeon is scrubbing in and getting ready to do the surgery, comes in, looks at the patient, looks up at the nurses and says, "I can't do this surgery. That patient is my son." And oftentimes when you tell a riddle like this, it'll confuse a lot of people, an awful lot of people. Not everybody maybe, but enough. And what's confusing about it was, well, how can that be the surgeon's son if the father died in the car accident? And some of the time people might think, when I've given this riddle before, they might say, well, clearly he has two fathers, he was adopted. Or maybe he has two fathers because his dads are gay. All these things are possible. But it's also perhaps easier to assume that, well, maybe the surgeon is his mother. But for an awful lot of people, that's a hard thing to assume. It's because the image in our mind of the top surgeon in the hospital might make it incompatible to imagine that the top surgeon would be a woman, could be his mother. If this were the image that we had in our minds of what a top surgeon looks like, well, then I'd have to tell that completely differently. I'd have to say something like, there's a car going down the road, two women in it, a mother and a daughter. That's the way I would have to tell the story. If what you see on the screen right here is the predominant image that people have in their minds of what a top surgeon looks like. That riddle only works because of implicit bias. It is an implicit bias riddle. The implicit bias makes a blind spot in our mind, in this case, about something we would not assume about somebody. We would not assume that a mother, a woman, would be the top surgeon. But implicit biases can also be about the images regarding what we do assume, the image that pops into our mind when we're cued to think about a child with a challenging behavior, or the image that might pop into our mind when we're cued to think about a child who is the teacher's pet, or the image that pops into our mind when we're thinking about a child who's the most creative in the classroom. I was interested a while back on the rate at which children were being expelled from preschool programs. We did a study released back in 2005 and found that children in preschool programs, these are pre-K programs, 3 and 4 year old kids, mostly programs that were either in the public schools or operating under the supervision of the public schools. Those children in these preschool programs were expelled at a rate more than 3 times that of kids in grades K through 12 combined. An awful lot of expulsion in preschool programs. And when we looked at childcare programs, the rate was about 13 times that of grades K through 12. I think the main reason why there's so much more expulsion happening in early childhood programs is because we can. When we're talking about K through 12, when a child is not in public school, then it creates a legal challenge because the child has to be in school. So there's a legal implication for expelling children. And so the process is a fairly legalized process. But in pre-K and childcare programs, it's very easy. You just say, we just don't think this is the right place for your child. And then out the door the child goes because there's no legal implication for it. And therefore, the process is not a legalized process, it's a very informal process. We also know that boys are expelled at about 4 times the rate of girls. And we know that Black children are expelled about twice the rate of white children. And when you put those two together, Black boys in particular are at an incredibly high risk of being expelled. I'm not saying an incredibly high risk of having challenging behaviors. I'm saying an incredibly high risk of being expelled because of whatever behaviors that they're bringing into the classroom. And there's a lot of different ways that you can kind of graph this kind of stuff. Here's the pre-K expulsion rate in terms of number of children expelled from a preschool program per 1,000 children enrolled. Here's what it looks like in K through 12. And so what's the analogous thing to expulsion when you're talking about adults? Right? I would make an argument that perhaps it's incarceration, because incarceration basically is expelling an adult from the greater society, just like expulsion is in preschool and K through 12. So what is the expulsion rate into incarceration for adults? Well, in the United States, it's about the same as the pre-K expulsion rate. But what's more interesting is this: the degree of racial disparity and the degree of gender disparity between preschool expulsion and adult incarceration is almost identical. So in other words, this doesn't necessarily prove that there's a preschool or prison pipeline, but if there is, it's amazing how consistent the diameter of the pipe is, all the way from pre-K to adult incarceration. This exact same demographic of children that are at risk of being kicked out of preschool programs is identical to those that are more likely to be sent to prison. So this raised for us a question of, is it possible that implicit biases or other things might at least partially explain why it is that our Black children, our boys, and in particular our Black boys, are more likely to be expelled from preschool programs? So we set up an experiment, and I'll show you a little bit about it. So in the experiment, what we did was we had teachers from all over the country, 135 of them, and they watched a video, and they had headphones on while they were watching it. And at the bottom of the screen, there was an eye tracker, shot a little beam off of their eye. It could tell us down to a pixel and down to 1,000th of a second exactly where the teacher was looking. And the instructions were, this is going to be a video about 6 minutes long that's going to show you children in a preschool classroom. The secret to being able to handle challenging behaviors is to be able to identify a challenging behavior before it becomes too problematic. Watch this video. We're going to track your eyes. Every time you see a child do something that could turn into a challenging behavior if the teacher didn't intervene, hit this button. That's what we told the teachers. The parts that we didn't tell the teacher is this: there's going to be no child misbehaving in any of these videos. And the reason we know that is because all these children are child actors that we've hired and placed at a table. And their acting job is to quietly play with Play-Doh. And so we're really not interested in whether you can find the challenging behavior. What we're interested in is this: when I lead you to believe that a child's going to misbehave, who do you look at? Who do you look at first? Who do you look at longest? Who do you keep going back to because you must have missed something? In other words, if you weren't a preschool teacher, but instead you were a mall cop, who would you be following at the gap right now, just in case that person picked up something and stole something? And that's basically what we were looking at here. So this was not a study about, how quick can you find behavior problems. It's really a study about implicit bias. And to give you a sense of what it actually was that the teachers were seeing, I'll play just a few seconds. Did you see the challenging behaviors? There weren't any there to be seen. We had 6 minutes of it again, shot from a variety of different angles. In some cases, the white boy is in the upper left. In some cases, it's the Black boy. In some places, it's the Black girl. We shot it from different angles in order to be able to equalize, which child was where in the videos. And then at the end of it, the screen goes blank, and we ask them, what child do you think you looked at the most? And then we ask them which child, to indicate it, and instead of me telling you what the findings were, I thought that it might be fun for you to hear it from Corey Turner of NPR News Education. So NPR covered this story. There was 2 parts to the study. The first part was the eye tracking study that I just told you a little bit about. And there's a second part about empathy in teachers. And I'll let Corey tell you what it was that we found in this 2-minute clip.
There's a new study out of the Yale Child Study Center that I had to read a few times just to believe what it was telling me. The researchers recruited about 135 preschool teachers. They had them watch video footage of 4 kids playing: a Black boy, a Black girl, a white boy, and a white girl. And they told the teachers, their subjects, watch the video, there may be some challenging behaviors. As soon as you see something that could become challenging, hit the enter key on your keypad. Well, here's the trick. There was no challenging behavior. The researchers were using eye scan technology to see which child the teachers were looking at the most. And what they found is that the teachers, both white and Black alike, spent the most time watching the Black boy, waiting for bad behavior that never came. There's one more really interesting headline in this study, which comes later. The teachers were also given a 1-paragraph description to read of a hypothetical child with a stereotypical name who behaves pretty badly in class, pushes, scratches, throws toys. And some of the teachers were also given some biographical information that helped make sense of that behavior. They were told that the child lives with his mother, father has been in and out for years, they're relatively poor, the mother is depressed, works 3 jobs. The researchers wanted to know if knowing this information made the teachers more empathetic to the kid. Well, here's the shock. It did, but only if the teacher and the child were of the same race. If the teacher and the child, a white teacher and a black child, or even a black teacher and a white child, knowing that biographical information, those teachers were less empathetic towards those students. And here's why this matters. Imagine if this is true, if there's this empathy deficit in preschool, well, imagine where else that's true.
Corey asked a good question there. Let me say just a few more words about what it is that we actually found. We found that when teachers were led to believe that a child's going to misbehave, they spent the most time watching Black children, and in particular, the Black boy. When we asked them who they thought they were watching the most, they thought they were watching boys more, especially the Black boy. Either way, the Black boy ends up in the short end of the stick. But the underlying bias that the teachers think they have seem to be more related to gender, that boys were more likely to misbehave. But the reality of what their eyes said was that the real bias that they had seemed much more related to race, not gender. So interestingly, when you think about these things, it raises the question of, how do we intervene? But aside from just thinking about the intervention, it also raises the question of, well, what do our children see from this? What do they notice, and how does it affect them? I was giving a talk similar to this in Las Vegas, Nevada back in 2018, and I gave my talk, and then somebody else gave a talk about biases in court systems. He was a judge, and then we were at lunchtime, and the MC came up on the stage during the lunch and brought with her a young girl who was in the audience, and I didn't know that there was anybody that young in the audience. It was the girl that you see on the left. But the MC asked her, well, what brought you here to the conference? And she said, well, I came here with my mother. And then she said, well, what did you notice about any, in any of the talks before? And she said, well, I remember when that professor guy was talking about how teachers look at kids like me. And I'll be very honest with you, I became a bit concerned and a bit scared. And the reason why is I try to remain cognizant of the fact that when I give talks like this, I'm not talking about how we see children who look like my white daughter. I'm talking about how we view primarily children of color. And I try to remain cognizant of that because there might be parents in the audience who have children of color, and this is very different for them than it is maybe for me thinking about a topic like this, because it's just so close to home. But I didn't really expect that there would be a child herself there. So I was actually very afraid that I might have said something that might have hurt her, that it might have hurt her feeling about schools and how teachers view her. And so the MC actually asked the question that I wanted to know the answer to, but I would have been too afraid to ask maybe. And she asked that little girl, she said, well, how did that make you feel? And then this little girl said something that I will never, ever, ever forget. She said, well, my friends and me, we already knew it. We just didn't think you all did. It's just fascinating, isn't it? I was worried that I might say something that would hurt her because I was worried that I might say something she didn't know. And the reality is I can study this all the time, and I can try to use fancy eye tracking technology to be able to measure it, but I'll never really feel it like she does. I'm not telling her anything she didn't already know. She already knew all of this, and she knew it long before me, and she knows it at a level that I can never study it because she can feel it, and it also means this too, I think, and that's that, we adults, when we're in classrooms, when we're making decisions about schools, we may see our behaviors filtered through our best intentions.
Walter, can I stop you one quick second? And please I'm so sorry, just to ask you if you could speak up just a little bit so we can hear you a little more clearly.
Oh, I'm sorry.
No, you're fine. Thank you so much.
Sure. But the children in our care, they don't see our behaviors filtered through our best intentions. They see our behaviors just straight, without any filter to it, and that's the other thing that I learned, when listening to her talking about how she already knew it. So, I'll leave there with the presentation, and I'll just stop by saying just a couple of words about the fact that since this study came out, and we've been working with different state legislatures and things like that, and in governor's offices and things, the study came out in 2016. Just in the intervening, really pretty much the 3 years after, because nothing happened much during COVID. In the 3 years that came out after that study, 16 states passed laws banning preschool expulsion and suspension, protecting about 1.2 million children every year from preschool expulsion and suspension. But there's many other states that haven't done anything like this. And there's certainly about 25 states that have not only either passed legislation banning it, but also have perhaps put money into early childhood mental health supports and things like that. The ability to come into classrooms and diagnose mental health concerns is also the power to come into classrooms and say, that's not a mental health concern. That's something else. That's perhaps the way in which you're looking at children, the way in which you're making expectations about children, that in some cases, the thing that we're concerned about is just normal child behavior that looks different if we have different expectations for children, or looks different if we're afraid of that child. I mean, there was a study that was done that they were studying how we think about children and their behaviors, and they had pictures of white kids and pictures of black kids, and ultimately the finding was that we tend to hold children of color more likely as culpable for a bad behavior, or more guilty of the bad thing, in comparison to white children when things are ambiguous. But the real shocker in the study maybe was when they asked them how old they thought the kids in the pictures were. And all the kids in the pictures were between the ages of 10 and 17. But on average, the respondents were overestimating the age of the children of color by 4.5 years. And that's a lot when you're only 10 to 17 years old. And we'd found with other studies that it's not just children of color, and it's not just boys, it's also bigger kids. Bigger kids in the same age classroom are more likely to be expelled for the exact same behavior. And when you collect more information on it, you dig a little bit deeper, the reasoning why is because the teacher's afraid that somebody might get hurt. They see the child as more dangerous. And so it's really not what the child did, it's the fears inside the teacher's mind about what that could happen. And if we look at our children of color and we see big, scary people, then we're going to punish them as if they're big, scary people, disproportionately so to other children. I'll leave you with this and say that I did not come directly to study implicit bias. I came to this incredibly indirectly. I was more interested in educational policy and getting kids in the front door of high quality preschool experiences and high quality early childhood experiences. But I could not help but notice over time that as many of us were focusing on the front door of quality and getting kids into programs, many kids were getting disproportionately pushed back out the back door. And then that made me realize that it's not just about getting them in, it's about the experiences that happen when they're in that program. And about the fact that in many cases, we push them back out. There's 3 main studies that you'll hear people in the early childhood field cite all the time. The Perry Preschool Study in Ypsilanti, Michigan. Every dollar is spent on early care and education yields $7.14 comes from that study. And the Chapel Hill study, the Abecedarian study. And then the third one is the Chicago Child Parents Center study. The Perry Preschool Study was a study of 123 children in Ypsilanti, Michigan, and every child in the study was Black. Every single child and family that was included in the study were Black. And the Abecedarian study, the number two most cited study to make the case for why preschool programs should exist in the first place, was 98% Black. And the Chicago Child Parents Center, the number 3 most widely cited study, 93% Black. What we've done in this country is this: we've taken data that belong to our Black children, Black families, Black communities, created programs for the benefit of all children. And then when we're not paying attention, we disproportionately kick out the back door the children whose data purchased the program in the first place. That's what we're doing. And it was that combination of realization that there is this back door that we push kids out of. And that it's incredibly unjust when you consider the fact that they were the contributors to the science that caused legislatures like you to pass laws to create early care and education programs. You know, that's the part that just became completely intolerable to me. And so that's why I'm in this line of work, and that's why I do this. I can also say that in addition to some of this legislation, there's been some states like California that have looked into how can we use subsidy rate multipliers in childcare programs in order to encourage more early childhood mental health supports. We've been doing some work on measures that measure equity in classroom and how teachers are more or less equitable in the way in which they distribute themselves. The main resource in any preschool classroom are the adults and the other peers of these children. You know, how do they distribute themselves? How do they interact with children? Do they pick up on subtle cues? Do they notice this child more, but don't notice that child over here? When something goes boom, are they calling somebody's name before they even get their head turned? You know, all of these things don't just impact the child who's the subject of it, but it also impacts every other child in that classroom who quickly learns and notices that there are some kids that are going to be treated differently than other children. And even if they're not on the negative side of that, they can pick up those biases. I mean, there's a whole science on the contagious nature of bias. You know, in many ways, bias is kind of like COVID. You can spread it even if you think you're asymptomatic, you know, and so that's where I'll end it with. I mean, we've been doing quite a bit of other research in the area, and so if you're interested in learning more about it, I'm happy to share it with you. Thank you.
Thank you so much for that as well. And you had the perfect segue with that last comment into our panel discussion. Kind of related to COVID, it's already been brought up in all three discussions today, really, and it's undeniable, right, that it's changed everything about the way that the early care and education system runs even. So my first question then to the panel, and we probably have about 15 minutes. Anyone can jump in if you'd like to, but I'm kind of curious as to what do you see are some of the bigger pros and cons of COVID adaptations in the early learning systems and settings? And, you know, what do you think those mean for populations of color as well as the economy? And I guess, you know, have there been any things that have been implemented that have been changed? I know, Constance, you touched on some of them earlier, and we got the question already about the virtual versus in-person home visiting, but things that have maybe promoted equity and maybe should stick around, or other things that you've seen that have actually been a hindrance? And anyone can jump in.
I can get us started. I think about two things. The higher rates of death in communities of color also means that we are losing educators. In order to protect themselves, we've had educators of color more likely to retire from the field. And then of course, also these are small business owners for small centers as well. And so in Black and Latinx communities, I know specifically that centers have been more likely to close permanently. On the positive side, family childcare providers have been more likely to see their enrollment increase, and family childcare providers are more likely to be women of color. And so there has been that balance, and it's because smaller settings means exposure to less children makes families feel a bit safer when their children are going to childcare now. So there is there will be work to do. We know that access to small business loans that kept some businesses afloat was not allocated equitably. And so there's work to do to ensure that there's outreach to those business owners who have had to close, and hopefully we can find a way to keep them engaged or to return them to the field.
Great. Constance or Dr. Gilliam, anything else you'd like to add?
I think another impact on the early childhood workforce is even if the center was open to support essential workers for if a provider or a child care provider had children at home that could not go to the workplace with them, they were also impacted. So the workforce has depleted due to retirements, as well as people who just cannot do both. So when the home and the workplace collide, I've had the privilege of working in my dining room for a year. Everyone has not had that opportunity, and I don't have 3 children and 3 different grade levels that are all trying to access broadband at the same time while I'm in a meeting. So some of those kinds of things around access and the assumption that all families have access to technology to engage virtually, whether it's from learning at home for school or otherwise, is somewhat of a misnomer. Even if they do have the broadband and the instruments, it does not mean they know how to use them or use them effectively.
Those are all great comments. So I mean, one thing that I can add is COVID caused an awful lot of people, including myself, to think way outside of the box, because the box wasn't there anymore. And in a way, it was quite the bizarre irony that I'd been spending so much time studying children being expelled from school, and then all of a sudden every child gets expelled from school. And what that impact of that is, I ended up putting together a team of epidemiologists and vaccinologists and things, and we did a study of COVID-19 transmission in US childcare programs. We had a sample of over 57,000 childcare providers from across the nation. Many of them were home-based programs, and some of them were center-based programs. And we looked at the degree to which being in a program versus working in a program that had closed or you quit working was related to the likelihood that you as a provider might get sick from COVID-19. So in other words, what's the relationship between exposure to childcare and an increased likelihood of being COVID-19 positive yourself? And we controlled for the amount of COVID in the community. And the overall finding was that there was no relationship. That COVID-19, that childcare programs didn't seem to be a significant spreader of COVID-19 above and beyond just being alive in your community. It was one of the first studies, actually it might have been the first study that came out of COVID-19 transmission in either schools or in childcare programs, to be able to sort of inform, questions regarding, how safe is it for us to come back. But there was a few other things too that were in there that are worth noting. And that's that, even though providers who went to work were more likely to get sick from COVID-19 than the providers who stayed at home, regardless, our providers of color were far more likely to get sick, far more likely to be hospitalized, far more likely to live in a home with someone who has died of COVID-19. And when you look at the other variables in the study, well, and actually I should back up. At the top of the list in terms of risk for COVID-19, and again, this is not COVID-19 that they're getting from childcare. This is COVID-19 just from community exposure. At the very top was Native American providers, and then under them were our Black and Brown providers. And the white providers much less likely. And then when we looked closer at some of the reasons why that we could find in the data set, it was a variety of things having to do with, they were also more likely to live at home with other essential workers, and issues having to do with housing inequality and housing density. I mean, all sorts of other things. And when we also asked them questions about like personal protection, like, do you wear a mask when you go out? Do you wash your hands frequently? Do you do this? Do you do that? And what's interesting about it is the childcare providers who are going to work were taking even greater levels of precaution in their private life than the providers who weren't. But aside from that, our Black and Brown and Indigenous providers were taking way more precautions for personal safety than our white ones were. And so the increased risk didn't have anything to do with private decisions, personal decisions. In fact, the personal decisions were protective for them. The increased risk had to do with systemic issues of who is it that keeps going to work while people like me get to stay at home and do their job over Zoom. You know, and it was those kind of factors that really made the biggest difference. And if there's anything that I would highlight from all of that, it's this: when kids go back to school, and they are going back to school now, there's going to be an awful lot of stress that goes back to that school with them. Whether we're talking about preschool children, elementary, middle school, high school, there's a lot of loss that a lot of kids have experienced. A lot of families have experienced a lot of loss, a lot of stress, economic, but also personal. People who have died in their family, people who have become incredibly ill, and people were worried that they could die. Or many of our Asian families who have experienced an awful lot of hate and bias directed at them because they were seen as the agent that brought COVID here. You know, and so all of these things conspire to mean that an awful lot of stress are going to be going into our early care and education programs, and our providers and our teachers, they're going to have a lot of stress too. They already do in their personal lives. And so their fuses are going to be far shorter than they ever were before. They're under a lot of stress too. And they're going to be confronted with massive amounts of stress from the children and the families that they're seeking to serve. All of this is going to conspire to mean that the mental health needs of these children, families, and staff is going to be absolutely off the chart. We've been working right now not only to try to think about, you know, how can we proliferate better early childhood mental health consultation services and mental health supports, but how can we do that over telehealth systems? And one of the things to know about the American Rescue Package that just recently passed is that there's a significant amount of money in there that's going to be going specifically to states that has to be obligated very fast. And like 24 million of it is specifically for childcare. Of that, 12 million of it has to be obligated within 12 months. And there's 4 things that are listed in there. And the fourth of those 4 things that it can be spent on, mental health supports. And so trying to think about how can we be able to build infrastructures for better mental health support, either telemental health infrastructures or infrastructures for training up a workforce to be able to provide mental health supports, so that we don't spend it on things like one-off professional developments or buying a bunch of laptops that nobody needs. You know, how do we not spend this money on empty calories, but instead spend it on smart infrastructure that's going to serve us for many years after the money dries up? Let's not make error mistakes with this money.
Absolutely. Thank you so much. And I think you're leading perfectly into the last question for our panel, which is just what would you say are like 1 or 2 real brief key takeaways then for state legislatures, you know, leading into having these federal dollars, knowing that you have to spend them in a timely fashion. What would be your 1 or 2 key things you'd like legislators also to keep in mind moving forward?
I think one thing that's important to keep in mind is how you procure family relationship-based services like home visiting, and not necessarily procure them like you procure paper or laptops, and consider where success has been experienced in certain communities, and not looking at a needs assessment and thinking they don't need it anymore, when it may have been the strategy that helped move the needle, and the strategy needs to stay there, and really think more in terms of opportunities to scale rather than pick off from one place to another. And the same when it comes to who's delivering services. So adding additional models to communities for options and for choice. The reach is so tiny. And I think another thing that we did not mention that is a challenge is a lot of early childhood screenings occur in early childhood centers. They're not happening in the midst of the current climate, and they were already at a much lower rate than they should have been.
I would suggest thinking very deeply about how can the resources that are going to be made available right now for childcare programs and also K through 12 be spent on sustainable things. You know, there's only so much PD that people can go to. And I know that it's really easy to fund a lot of PD when you have to blow through some bucks really fast, but there's only so much that people can actually attend. Can we build infrastructures that are going to be lasting longer? Like if we want to do mental health supports in a sustainable fashion, I'm not saying all of it should be tele, but to the degree that we can make some of it tele, you can actually decrease an awful lot of the costs. Right now, we spend a lot of money driving people around in cars from one school to the next, and so, at the same time, like I was working with some leaders in a different state, and we crunched some numbers and we figured out how much money was spent basically just driving consultants around, going from one place to the next. And then we figured out, what would be the cost of tele versions. But of course, there's an upfront cost where you have to, build the platform out. But then, of course, it raises the question of, well, some people might not have access to the equipment that they would need in their homes or in their programs. There's a digital divide, and that digital divide has equity issues attached to it too. Or maybe they haven't purchased broadband services. And when we crunched the numbers a little bit farther, we figured out, you could get everybody an iPad with a camera and buy their telecom way cheaper than driving somebody around in a car all day long. And so there might be a lot of things that we can do that actually provide a lot more equity and equitable access to the services, including literally buying people equipment that they need and buying them broadband that might be much cheaper than the current things that we're doing right now, which doesn't serve a lot of kids really well either. The other thing that I would try to suggest too is when you're making these decisions or when you're passing things down for other people to make decisions, putting a little bit of thought into how is the community's voice being heard in this? Who is it exactly who's deciding what the community needs? Is it the community? Is it professors like me at a university making wild guesses? Is it an administrator who needs to spend some money real fast? Like who ultimately is it that's hearing what are the main problems that really need to be solved, but also how would I want them solved? And how would I want to be a part of that? And if there's no mechanism at all for getting that kind of a feedback from the community, and also getting feedback from the community as to whether it's working well or not, then ultimately it's just a bunch of saviors making guesses.
Great. Wow. Thank you so much. I'm sorry, okay. Thank you so much to our presenters. We're running short on time here and I want to be respectful of everyone's schedules, but thank you so much. Cannot thank you enough, Seema, Constance, and Dr. Gilliam for sharing all your time and your expertise with us. Thank you so much, everyone, for coming today and participating. And I'd just like to take a minute to thank our own very generous sponsors as well, the Buffett Early Childhood Fund. So quickly, before I let you go, we'd love to hear your feedback about the session. Please take a minute or two to complete a brief survey that you'll find in the chat for a second. And also, here's the really big part, okay? Not the survey itself, the fact that if you finish the survey for us, we're going to give you a $5 Starbucks gift card as a thank you. So please do take the time to let us know what you thought about today's session. We really do take this feedback really seriously and want to make great programming for you moving forward, and that helps us out a lot. So I'll also follow up on today's discussion via email with a couple additional resources next week, and we'll have some content from today available on our Early Childhood Fellows Alumni Series website soon as well. I also just want to quickly note a joint initiative between NCSL, the National Association of Counties Research Foundation, and the National League of Cities to host intergovernmental meetings focused on prenatal to 3 policies, offering solutions to many families face. The first meeting is going to kick off next week, and so we hope you'll be able to join us for that one and for others. Finally, please mark your calendars for our 5th and final session in this series that's going to take place on Friday, May 21st at noon Eastern Time. And we're going to be focusing then on young children's environments through a racial equity lens. If you have any questions, please feel free to reach out to us anytime. We are your organization. We're here for you, and we want to help you to do the best legislative jobs that you possibly can. And please don't hesitate to reach out. Call on us anytime. And with that, I will thank everyone so much again for participating. and wish you all a good day and a great weekend. Thank you for coming.